Thanks, Donald. Good morning. Thanks for joining the Office of Emergency Preparedness Lunch and Learn series. I'm Scott Shahan. I'm the Occupational Health and Safety Manager on VDH's Occupational Health and Safety team. Today, we're going to do a little overview of some worksite safety pieces. Occupational health and safety is an area of public health, focuses on injury and illness trends in the workplace. The scope of occupational safety can be very broad. It encompasses multiple disciplines, from hazardous materials and the spread of disease to ergonomics, violence prevention, and even in things that would typically considered industrial type of injuries. If you think about the diversity of the VDH workforce, many things fall into that public health category. So part of getting started is understanding where occupational health and safety regulations come from. And before I dive into that, I just want to remind everybody, if you registered as yourself and are logged in through your train link, you'll be fine. If you're in a Polycom, a conference room, a meeting room, and you're registered through Polycom, if you would email EP&R training@vdh.virginia.gov after the lunch and learn, that way they'll be able to verify you and train that you were in the session, and you'll get your transcript accordingly and train updated. So when we're talking about occupational safety and health laws, we're talking about OSHA, Occupational Safety and Health Administration. That's the federal side of the house. The law was signed into, the OSHA Act was signed in 1970 and became law at the end of that year. They promulgated rules and regulations that govern the workplace. One particular piece is the general duty clause at the beginning of the act, where it requires the employer to provide a workplace free from recognized hazards that can cause serious injury or illness. The act also allowed states to run their own plan. Virginia is one of those. Virginia is what's called a state plan state. So when we talk about OSHA, we're really talking about VOSH, Virginia Occupational Safety and Health. That's managed by the Department of Labor and Industry, one of our sister agencies within the government. They're the ones that will conduct inspections of workplaces in Virginia. They'll respond to employee complaints, or they'll be the ones issuing citations or civil penalties or providing consultation services. We partner with them in multiple levels. Obviously, during the pandemic, there was a lot of back and forth, but in a lot of day-to-day, VDH and Department of Labor and Industry are both members of the Occupational Safety and Health Codes Board that helps establish the regulations in Virginia for workplaces. Virginia has some unique standards that are separate from the federal regulations. Instead of rewriting all of the occupational safety and health regs when the act was created and Virginia became a state plan state, the federal rules were adopted by reference into Virginia code. The only stipulation was if a standard was going to be more strict than the federals, it would have its own unique section. And there are 9 of those in Virginia code that are stricter than the federal OSHA standards. Also, there's an administrative regulation manual that's covered in the code section you'll see on the screen that details what Virginia Department of Labor and Industry does and how we interact, or they interact, with other employers. One of the unique standards in Virginia that's not strictly an occupational safety and health code, but it crosses over. If you look at Virginia Code 32.1 through 45.1, we're talking about deemed consent. And any of those healthcare professionals listen to this, or any of those folks that are familiar with bloodborne pathogens and the protections we've got to do for that, deemed consent is one of those that allows for testing source blood when someone who has an occupational exposure to blood or body fluids that could contain those bloodborne pathogens. That code section allows us to test that source blood. and follow some other regs. So that's one that is not codified in OSHA, but it is in Virginia code. Some other places we look for standards is everything's not written in the code sections. Sometimes things are incorporated by reference, which means that just like with the Virginia code referencing the OSHA standard as adopting by reference, that means it's incorporated into Virginia code. So we can enforce those federal rules because it's actually the Virginia code we're enforcing. But then there's also consensus standards out there, and there are other organizations that provide both incorporated and consensus standards. Some you may be familiar with, CDC, but CDCs are consensus standards. They're not the law, they are guidance documents that we follow. NIOSH, National Institute for Occupational Safety and Health, is not a subsection of OSHA. That NIOSH belongs to the CDC, but they do equipment testing, they do certifications, they do mortality investigations, things along those lines as well to help us with trending. Obviously, FDA, Food and Drug Administration, there is a crossover. There's links between NIOSH. NIOSH is the organization that certifies our respirators. We will only use respirators that have a NIOSH certification. But in the case of healthcare, we may cross over with FDA, and FDA certifies surgical masks. So oftentimes in a healthcare setting, we use an N95 respirator that's got a cross certification with FDA as a surgical mask. Not every surgical mask is a respirator, and not every respirator is a surgical mask. So we're complying with two sets of regulations there. And then we have others, ANSI, American National Standards Institute, National Fire Protection Association, and the Environmental Protection Agency. The reason I threw EPA in there, obviously with epidemiology and environmental health services, we're going to see some, you have seen some upcoming training or some guidance and information for healthcare professionals on PFAS and things that affect the environment. Those also affect those at work and us as the general public. So EPA comes in there. Another area where EPA is something we look at when we look at occupational safety and health in a work site. EPA promulgates guidance documents for indoor air quality. OSHA doesn't have anything specific about indoor air quality other than specific regulations for things like hexavalent chromium and some other chemicals and other things like that in the workplace. But EPA's guidance document on indoor air quality affects all our workplaces. How many air exchanges there are in an office or a clinic or a shop. Depends on what type of work's being done, how those things are tasked. And then when we find an issue, what are the levels we're supposed to look at? So those guidance documents are consensus standards, and we tie back to that general duty clause when we talk about providing a workplace free from recognized hazards. If a consensus standard says there's a hazard, maybe we need to look at it. So that's basically where some of those laws come from. Some of the things we have to follow as employers. We're required to investigate and keep records of occupational injuries and illnesses. BDH uses an accident and injury investigation report to capture that. Workers' comp needs first report of injury reports, and that's the workers' comp liquid web form that is usually filled out after an employee's injury. There is a difference between OSHA recordability on the OSHA logs and workers' comp first report of injuries as far as compensability. We're not going to get into that today because there is a difference. And you can have an injury that is compensable under workers' comp and not recordable on an OSHA log. And the inverse, you can have an injury that's recordable on the OSHA log and it's not compensable under workers' comp. So it's a separate law and needs to be handled separately. HR is the prime contact on workers' comp. One of the other things after we record those injuries on the OSHA log is we have to post that summary as an employer. We post the OSHA 300A summary of those work-related injuries and illnesses, and those are posted annually from February 1st through April 30th. So it should still be on your bulletin board. In my career history, once I've posted a summary, basically I don't take it down after April 30th. I leave it up. That summary is a communication tool for us to see as employees the injuries that have occurred in our workplace, whether they were just recordable, whether they were lost time, whether they were restricted time injuries, and how many days were missed in our workplace because of those work-related injuries. So that's a communication tool we can look for on our bulletin boards with information about our workplace. This is what an OSHA log looks like. This is the OSHA form. We do use it. It's strictly a list, but we assign case numbers. It has the employee's name, job title, date of the injury or onset of the illness, where it occurred, and a brief description of what happened in the body parts that were injured or the injury. Then we look at what category, whether it was a fatality, days away from work, restricted days, or other type of recordable injury, and then how many days were lost in restricted days. It also breaks down the category, whether it was an injury, a skin disorder, a respiratory condition, poisoning, hearing loss, or all other types of injuries and illnesses that don't fall into those first categories. So basically this looks like this. It should be kept for each establishment. You can have in one area, you can have multiple establishments. If you have uniquely different activities going on within the same building that are extremely unique from each other, you could have 2 establishments, 2 logs, but generally our establishments are by address. So this should be unique to your workplace. Also, other sections of a log, if you notice at the note at the bottom, is we talk about sharps injuries, and we're talking about contaminated sharps. So needle sticks, scalpels, anything that is contaminated with blood or body fluids that could contain bloodborne pathogens, is we keep a separate sharps injury log for those. Because if somebody doesn't serum convert from the exposure, other than the initial injury, which may not be reportable, it doesn't go on the full log, so it's kept as a separate log. Also, there's cases of what we consider privacy cases. If a part of the body that is injured is a sensitive part of the body, we may put the information on the log except for the employee's name and title, and make it a privacy case. If we have a privacy case, we do need to keep a separate log and list of those with all the information that's on this log with the employee's name. That privacy case list is not one that's shared with everybody. This log is something that can be looked at by anybody, any employee at any time. Not general public, it's not a FOIable document, but if an employee wants to look at the log, they can, whether their name's on it or not, whether they've had an injury or not. It is another way that we have as communication. It's our right to look at that. That summary I talked about, the OSHA 300A, looks kind of like this. It has the establishment's information on it. It'll have the average number of workers for the year, the total hours worked for the year, and then a breakdown of the type of injuries, fatalities, lost time, restricted time, or other, and the days, and then the category. Again, this is the communication tool for us. And if you notice, it's supposed to be signed by the executive at that location for that establishment, whether that be a director, whether that be a COO, whether that be someone assigned with the responsibility to do this, but that's signed by them because it's stating that everything's been reviewed and this is as up to date as we can get it for the calendar year, for the previous calendar year from January 1 through December 31st. And again, posted for our benefit as employees. So what constitutes an accident in the workplace? Well, basically any unplanned or unwanted event, and I'd be happy to answer any questions later on. If somebody wants or plans an accident, I'd like to know about it. Accidents are controllable. Most people work under the assumption that accidents just happen. They don't. They are controllable. The accident is something that stops the normal course of events, and it causes bodily harm or property damage. So it can be a pulled muscle, it can be a needle stick, it can be a laceration, it can be an injury from a slip, trip, and fall. But all accidents have those things in common. We investigate those hazards to help us identify the causes and recognized hazards that were the causal factors in that injury or that illness, because we want to eliminate or reduce those hazards by corrective action. We recommend preventive actions, and that's where we bring in safety committees and people like our occupational health and safety team to help with preventive actions, because it's one thing to mitigate a hazard. We got water on the floor, we clean it up so nobody else slips in it. But why was that water on the floor? What was the cause? What was the root cause? So we can prevent any future occurrences of that hazard. We investigate to expose deficiencies in processes and equipment. Healthcare professionals for years and years and years had needle sticks, and needles and hypodermics have improved. One of the earlier lunch and learns we had was on needle safety. So we have developed over time engineering controls for those needles to try to remove that hazard and avoid that from an equipment standpoint. We investigate to maintain and improve our morale as employees. The better job we do at removing those hazards, identifying them, correcting them, preventing them from occurring, makes us feel better in the workplace, and it should. If we have a safe workplace, it allows us to concentrate more on our workload and less about looking over our shoulders. We investigate to save money. Accidents cost money. There's direct costs and there's indirect costs. Direct costs can be medical for the injured person. It can be repairs to equipment that's damaged. Those types of things are direct costs. Indirect costs, overtime, other people having to pick up or bring in extra people to work to cover for the injured person. Fines, other types of costs associated with that injury fall into that indirect category. And national average, this is not Virginia, this is national average. An injured worker, a work-related injury for that employee, oftentimes can be up to $8,000 of out-of-pocket expense for that injured employee. In addition to those direct costs, workers' comp, medical bills that are paid for. Oftentimes, that's an average nationwide. So it's to our benefit as employees that we identify those hazards as well. And the last reason we do it is because the law requires us to investigate. But that's not the reason we do it. We do it to identify the causes and the hazards that are there so we can eliminate them. This is the VDH accident investigation form. It's available through the internet page right now. We are working at creating this as an electronic document to make it easier to submit and gather the information. This is first half is this section 1 is filled out by the employee. A lot of the information on there is what workers' comp needs and is put into the first report of injury and submitted with that. Things like whether the person's VSDP, their marital status, number of dependents, whether they're on state health insurance or not, that's workers' comp information. Some of the other things, witnesses, time of injury, date of injury, date and time was reported, when you started work on that day is very important, where it was in your shift when an injury occurred. But this section's filled out by the employee unless they're not capable, and then it can be filled in by the supervisor. And then section 2 is the supervisor section where the actual investigation information is put in there. And besides this form being electronic, as we're going to be publishing and preparing some accident investigation training, because every supervisor or manager may have to conduct an accident investigation and be the first one to gather the information after they take care of their employee and get them treated and taken care of. They have to know what to look for, whether it's how to describe an unsafe act and condition, what you're looking for when you're looking for those unsafe acts or conditions. And when you're talking about root cause or causal analysis to identify corrective action, there are scientific methods to determine those root causes and those proximate causes, which is the immediate cause of the accident, and how we're taking care of those. So this information is very important. This is also going to get expanded into some of the safety event reporting where we have visitors, which covers volunteers, interns, appointees, and other folks in the workplace that are actually working there. Contract employees, you can have a contract worker sitting right next to a VDH employee doing the same job. And if that contract worker's hurt, we need this investigation done on them as well. So we're going to be starting to capture more and more data on those to be able to try to make our workplaces safer and remove those hazards. One of the other ways we identify hazards in the workplace is by hazard assessments. Very similar to any other review of what we're, whether from a healthcare perspective or an audit or an inspection, when we're looking at tasks associated with a particular job description or office or work area. We look at the tasks, we look at the identified hazards that we can see to do that. And then we rate those. We look at severity, we look at frequency, and those numbers tell us what risk level. And this is arbitrary as far as numbering goes to this, but if we have something that has a high severity but a very low frequency rate, we may still have it at a higher risk level, but doesn't necessarily mean it's our first priority. But if it has a very low severity, but we have a high frequency rate, means we have a lot of exposure to it and we need to take care of it. So things like slips, trips, and falls for walking is one that shows up a lot for state employees. It is actually the number 2 injury type that happens to state employees every year. It flip-flops a little bit with material handling, lifting, toting, and hurting our backs and legs and necks and arms, but slips, trips, and falls and manual material handling go back and forth with that. So once we identify those hazards, we have to institute some kind of controls. And when we look at those, because back to the general duty clause, the employer is responsible for a workplace that's free from those recognized hazards that are going to cause serious injury, illness. So we look at engineering controls, designs, guards, insulation, things like that. Those self-closing needles for the needle sticks. We enclose or isolate processes when we can. We substitute less hazardous materials for more hazardous material. Then we can use administrative controls, which is things like job rotation, adjust methods, additional training. Along those lines would be administrative controls. And then last way to control the hazards is personal protective equipment, PPE. We do sometimes a bad job. We throw a lot of PPE at a lot of hazards before we look at those first two, because we have to engineer it out if we can. We have to administratively control it if we can. And if we can't do those, then we can utilize PPE to control that hazard. And that PPE is the last layer because it's personal protective equipment. It's on our bodies. That's what's protecting us from the hazard. So that's the hierarchy for us to control those hazards. This slide is just a contact slide for your occupational safety and health team. With me, we have 3 clinical occupational health and safety specialists within the team, and then we have 4 safety specialists as well. So their phone numbers and their contact information is on that slide. We're here to help you. We've been visiting and we have identified hazards and are working with a lot of places on improvements and doing other trainings. So that's kind of everything in a nutshell on worksite safety from an overview standpoint. I'm going to stop sharing my screen now, excuse me, so I can see the chat.
All right.
And
go to next day.
There's nothing in chat.
Okay, thanks, Donald. There's nothing in the chat. If there's any questions, you don't have to type them into the chat now. Feel free to unmute and ask me questions if anybody has any at this point. I appreciate your attention.
Oh, roommate is my friend.
And I don't hear anything. If anybody's trying, please make sure you've unmuted yourself. In the case of occupational health and safety, silence is not always golden. If we don't know about something or we have confused people on an issue, we need to clarify it. Hopefully we'll be doing that. You should be seeing more documents, the respiratory protection program documents, and our medical clearances and hazard assessments should be starting to be published in June. So you'll see a lot more going forward. Some of these lunch and learns, we've covered other topics. And yes, this session is being recorded, and it will be put into the archives and train for these sessions and available that way as well. Thanks, Steve. Okay. If there aren't any questions, thank you all again for participating in the Lunch and Learn series and being here today. Share with your folks if you were taking some of this information back or you're part of your local safety committee at your local office, and share the information. Go in and retrieve what you need from the archive. And also EP&R training will, if you've registered, I know Donald sends out to those registered a copy of the PowerPoint and a copy of the notes page, because all those slides had notes below them. Hopefully I said most of what's on those notes. So there's some more history in there that you can use. So please, any questions we've got or you've got, please send them to me or any of the occupational health and safety team contact points. And if there's no questions, we'll get off of here a couple minutes early, and y'all get back to your day, and please stay safe. Thank you.